So I'm an infectious disease doctor. So I end up being kind of one of the uh, sort of players in the preparation and guidance that is given to the hospital where I work. And since I'm the only infectious disease doctor, it's a busy time. Right now, my role has nearly completely changed. So I see very few patients in the office, but I spend almost all my time in the hospital doing planning for COVID patients, planning for the hospital's response, making strategies for how to, offer the best protective devices for, oh geez. Want to see our protective devices?
Right.
Yeah, so let me show you what we wear all day. So we're very lucky because this is our usual protective device that we wear every day when we see patients. And this shield was made by a 3D printer by a local person. There's a whole team of local people that have been offering to make these, as a gift to us. And they've been a huge, huge help to our, kind of goal of keeping healthcare workers safe. Today, my day was filled with strategizing of how to identify patients that we may want to put on a antiviral study, how to get those patients to a tertiary care center, how to start to learn how to do some different techniques with the ventilator in the hospital, making sure we have enough masks. I'm on a task force to be sure that besides these things that I just showed you, we have enough of all of our other equipment. We had to troubleshoot a patient that was tested positive in an area, then other people had to be test positive. So my day has completely changed to be very COVID focused in a variety of administrative ways.
It sounds like you guys are taking a ton of preventative measures without a doubt. Is there anything either in regards to that and in your own context, or even at a larger scale, that you're particularly worried about?
Well, I worry every day that there's going to be a surge of patients, and that are we ready for them? And so we have all these things in place, the special respiratory units, and increased our bed capacity and redeployed doctors and nurses into those areas and all those things. So I worry, but then I guess we have a great team that takes whatever the worry is, and then we translate it into, okay, we've got to do this project. I worry that there could be a bunch of cases in a local nursing home or a local, among the healthcare workers on the floor or whatever. That's why we just constantly are doing all this as much as we know how to do for prevention. I worry sometimes about my family and making sure that I don't get sick and bring it home. But, I feel very confident about what we're doing.
So do you think that we're flattening the curve right now?
Well, I think it depends on where you are. Of course, we heard today that New Zealand was very good at flattening the curve, weren't they? I think that as a country, I think that it would seem that early data right now would say that we've done better than they expected, that a lot of people complied with stay-at-home orders, and that's great. I think that you can't take your eye off the ball. I think that there are still plenty of cases that are going to come and need people that need to be taken care of. So modeling is good, but modeling is not perfect. But I think that everybody that is in healthcare looks at these models and says, that's very nice, but we still have to do our work.
Right.
So, and I think that outbreaks, we've certainly seen here, is that outbreaks and clusters of families or groups is the way this goes. And so there's every reason to believe that if a group is infected together, we would have a mini surge of one whole group of related people or friends, or, and that would, that would cause tons of patients that all need to be cared for. And so that's why there's constant reminders about, continuing to social distance in a real way, and not to think those rules are for everybody but you. So
You've referenced, I think, a lot of, which is great to hear, a lot of the kind of victories of our efforts to flatten the curve. What in general are your thoughts at a local, state, federal level about how we've responded to this crisis?
well, local, very local, I think we've done a good job. The numbers would say that we are not seeing at this point a huge uptick, and we're hoping that that stays that way. I think that's local to Bennington County, to, our towns, and to, the people that are in our community. The state, the state has done a lot. They were not the first on the, thing to get people to socially distance effectively, but they did come on early, and so I'm proud of that. They run a decent laboratory for testing, even though it's not as much testing as, anybody wants. They are, they're creating centers for people if there's a big overload of patients, that will, centers of excellence for patients to go to. So I think they've done a very decent job. The federal level is another, story. I think that it's been a challenge to watch that unfold. I'm hoping that there are lessons learned, and that Tony Fauci gets to keep talking and saying the truth.
Mm-hmm. What are some of those lessons that you hope we've learned?
I don't know how we could ignore that pandemics happen, that they happen fairly regularly, and that we need to be prepared. I am so angry, depressed, whatever, that people have lost their lives, based on not being prepared for this pandemic. And so, a national effort has to be done, and not ever, kind of frettered away in a way that we forget. It'd be hard to imagine that people could forget after all of this. Science matters, and that science is the truth, and science is an important, it needs to be the important leader in things like this. Science needs support and money, and that we need to, remain at the forefront of being able to handle, medical emergencies and everyday things that would have helped us be ahead of this. And then in a general way, that serving others, kind of, that's humanity is about, and that's what life is kind of about. And that the greatest, kind of names of what's happened in both kind of on the local level to me and in the larger world, is that the people that are giving are the ones that are the heroes, right? They're the ones that are saving the day.